Hello and welcome everyone. Today we are discussing about gallbladder. In this video we are going to discuss about anatomy, histology and pathology of gallbladder. Introduction. The gallbladder is small hollow organ about the size and shape of pear. The gallbladder lies in right upper quadrant of the abdomen affixed to undersurface of liver at the gallbladder fossa. It is a part of biliary system. The biliary system is a series of ducts within the liver, gallbladder and pancreas that empty into the small intestine. They are intrahepatic within the liver and extrahepatic outside of the liver component. The gallbladder is component of extrahepatic biliary system where bile is stored and concentrated until needed for digestion. It is attached to rest of the extrahepatic biliary system via cystic duct. Bile is a fluid formed in the liver that is essential for digesting fat, excreting cholesterol, and even possesses antimicrobial activity. It measures approximately 7 cm to 10 cm in length and 4 cm in width. The gallbladder fundus is wide, and as it continues into main body, it narrows in the diameter. The gallbladder body tapers into the infundibulum, which then connects to the neck and cystic duct. Now let's learn the normal histology of gallbladder. First is mucosal folds. In the mucosa, muscularis mucosa and submucosa are absent. The next layer is muscular wall containing smooth muscle. Next is perimuscular connective tissue, and last is serosa. Mucosa is made up of epithelium and lamina propria. Epithelium is single layer columnar cells. Epithelial cell nuclei are basally oriented, oval and uniform. Lamina propria is composed of loose connective tissue, blood vessels, lymphatics, and lymphocyte, plasma cell, mast cells and histiocytes can be observed. Next is muscular wall connective tissue and serosa. The loose bundle of smooth muscle fibers which are not very well formed in muscular wall. Next is perimuscular connective tissue that is composed of collagen, elastic tissue, fat, vessels, lymphatics and nerves. And last is serosa. Most prominent feature of gallbladder is Rokitansky-Ashoff sinuses. They are invagination of gallbladder mucosa into the muscle wall is called Rokitansky-Ashoff sinuses. Most common pathology involved with gallbladder is gallstones. They are cholelithiasis or choledocholithiasis. Second is inflammation. Acute, chronic or xanthogranulomatous inflammation can be associated with infections like acute bacterial, granulomatous infection, viral, fungal or parasitic infections. And tumor involving gallbladder are benign and malignant. Let's learn about acute or chronic cholecystitis. Most common cause is obstruction of cystic duct from small and medium sized gallstones that migrate from gallbladder, or in the case of large gallstone that they intermittently obstruct the neck of gallbladder, and obstruction by inflammation and edema. Most common symptom of cholecystitis is right upper quadrant pain radiating to right shoulder or back. Other symptoms are fever, nausea or vomiting, bloating, and pale or light colored stools. Complications of cholecystitis include perforation, local abscess formation, and peritonitis. The histopathological finding of cholecystitis is in acute inflammation. Acute inflammatory cells in gallbladder wall is found if the cholecystitis is associated with bacterial infection. And other findings are erosion of mucosa and edema. There are three types of lesions can be seen: acute, suppurative, gangrenous and perforative lesions. In chronic cholecystitis, chronic inflammatory cells predominates in gallbladder wall. Next is granulomatous cholecystitis. In extrapulmonary tuberculosis, typical case-shedding granuloma with AFB positive bacteria can be identified, but this condition is rare. Other infections associated with granulomatous cholecystitis are fungal and parasitic infections. Lesions like Crohn's disease and primary biliary cirrhosis are also associated with granulomatous cholecystitis. Third is Xanthogranulomatoous inflammation. It is characterized histologically by collection of lipid-laden macrophages admixed with lymphocyte, plasma cell, neutrophil and often multinucleated giant cell with or without cholesterol clefts. Fourth is parasitic infections. Parasitic infection can occur in gallbladder and they are associated with Ascaris lumbricoides and Cystoisospora belli. In addition, other parasites such as Clonorchis sinensis, Opisthorchis viverini, Opisthorchis phalaenus and Fasciola hepatica can also be reported in gallbladder. Benign tumors are polyp and adenoma. Cholesterol polyp and inflammatory polyp can be seen in gallbladder, and pyloric gland adenoma can be seen as a benign tumor. Last is malignant tumor. It is gallbladder carcinoma. The variants of gallbladder carcinoma can be vary, and they are biliary type ductal adenocarcinoma, intestinal type adenocarcinoma, mucinous carcinoma, clear cell carcinoma, signet cell carcinoma. So this is in short about gallbladder. These are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.